You wake up every single morning with that feeling, something stuck in your throat, like someone poured glue into your airway while you were sleeping. You clear it, you cough, you try to get it out. For a few seconds it's gone, then 2 minutes later it's back, right there again, and this happens every morning, every day, all day long, for weeks, maybe months. You've been to the doctor. They told you it's allergies. You took the antihistamine. Nothing changed. They said it was a little cold. You took the antibiotics. Still there. They blamed the dry weather, the AC, the neighbor's bonfire smoke. They gave you a bright colored syrup that helped for 2 days, and then everything came right back. You know what that is? That is your body trying to send you a message, and you still haven't understood it because nobody has ever explained the real truth to you. My name is Dr. Sanam Bodki. I'm a physician, and in the next few minutes I am going to tell you what is actually behind that pH lamp that just won't go away. It's not just allergies, it's not just the weather. And there are causes that most people never suspect, causes that even your own doctor often fails to connect to the symptom you're feeling. Stay with me until the end because the last cause I am going to share is probably exactly what happening to you right now, and it is the most overlooked cause of all. But before we get into the causes, I need you to understand one fundamental thing, something that will permanently change the way you see pH lamp. Mucus is not your enemy. Ignore it. Feels that way, but it's not. Think about it this way. Your body produces between and a quarts of mucus every single day, and you don't feel any of it because it works silently, doing an essential job. That mucus coats your entire airway from your nose all the way down to your lungs. It works like one giant invisible sticky trap. Everything you breathe in, dust, viruses, bacteria, mold, pollution, gets caught right there before it can ever reach your lungs. Think of mucus like the water filter in your home. It runs all day. It catches everything. It protects you. The problem starts when that filter gets clogged, when the mucus that should be thin, clear and easy to move becomes thick, sticky, and impossible to clear. And that is exactly when you start feeling that constant nagging irritation in your throat. So why does that happen? Here's what I'm about to show you. Cause 1: the dehydration you don't know you have. I am starting with the simplest one because it sits at the foundation of everything. Mucus is made up of about 97% water, just 3% is proteins, minerals, and antibodies. That means if you are not drinking enough water, your mucus literally thickens. It becomes like gelatin that sat in the freezer too long, dense, sticky, impossible to move. And here's the part that catches most people off guard. You can be dehydrated without feeling thirsty, especially after age 50. The thirst mechanism becomes less efficient. Your body stops asking for as much water as it actually needs. Most of my patients who come in complaining about constant pH lamp are drinking about a quart of water a day, and they think that's fine because they don't feel thirsty. The math is simple. You need about half an ounce of water per pound of body weight every day. If you weigh 150 pounds, that is 75 ounces, close to 9 cups. And don't tell me you drink coffee because caffeine is a diuretic. It actually makes your body lose more fluid than it took in. Start here. 2 glasses of warm water. First thing in the morning, 1 glass before each meal, 1 glass before bed. You don't save to chug it. Small sips throughout the day work just fine. This one change alone can make your pH lamp noticeably thinner within 48 hours. Cause the allergy condition you don't realize you have. According to the World Allergy Organization, between 30 and 40% of the world's population suffers from allergic rhinitis. In the United States, the CDC reports that over 81 million Americans are diagnosed with seasonal or year-round allergic rhinitis every year. But here's what is Interesting, most of those people don't know they have it. Why? Because they don't connect the pH lamp in their throat to nasal allergies. They think allergies mean sneezing, itchy nose, runny nose, and yes, it can mean that, but in many adults, especially older adults, allergies show up in a completely different and much quieter way. It's called post-nasal drip. Here's what happens when the lining of your nose gets inflamed from an allergen, dust mites, pet dander, mold, pollen, or even a sudden change in temperature. Your nose starts producing excess mucus. That mucus, instead of coming out the front of your nose, drains backward down the back of your throat, and it pulls there, especially when you lie down. That's why the pH lamp gets worse at night, and first thing in the morning you were horizontal for 8 hours, and that mucus was slowly draining into your throat the entire time. When you wake up with that thick, gummy feeling, that is the result of an invisible overnight process you never saw coming. I had a patient, let's call him at 71 years old, retired. He came in telling me he woke up every morning with a locked up voice and a throat clearing habit that wouldn't stop. He was convinced it was the bedroom air conditioner. We did a proper workup and found moderate allergic rhinitis, no sneezing, no runny nose, just silent post-nasal drip. 3 weeks into the right treatment, he called me to say he had woken up for the first time in 2 years without needing to clear his throat. The solution starts with investigation. If you suspect allergies, talk to your doctor about allergy testing to identify the trigger. Cause and a sinus problem that doesn't hurt. When most people hear sinus infection, they think about a pounding headache, pressure in the face, high fever, that awful sick feeling that puts you flat on your back. And yes, that is acute sinusitis, but there is another type, chronic sinusitis, and it is completely different. In chronic sinusitis, the hollow spaces around your nose, your sinuses, stay inflamed for weeks or months at a time, without necessarily causing intense pain. What it does cause is thick mucus that pulls and slowly drains into your throat, which you feel as that stubborn pH lamp that just won't budge. The Mayo Clinic describes chronic sinusitis as one of the most underdiagnosed conditions in adults, precisely because the symptoms are less dramatic than acute sinusitis. You're not bedridden with a fever, so you don't go to the doctor, but you've had that pH lamp for 3 months straight. Unlike simple allergies, chronic sinusitis often requires a more specific evaluation from an ear, nose, and throat specialist who may order a CT scan of the sinuses to see what is actually going on. In some cases, there are nasal polyps, small benign growths in the lining that block drainage. In others, it's pure inflammation. The mistake I see all the time: people take antibiotics on their own or get them from an urgent care that didn't investigate properly. Chronic sinusitis is rarely bacterial. Antibiotics will not fix it. Proper treatment involves saline rinses, a prescription nasal corticosteroid spray, and depending on the case, specialist follow-up. But please stay, because cause R is going to surprise you. It is something that nobody associates with pH lamp, and when I tell my patients, they look at me like I'm making it up. Cause R, the medications you're taking to stay healthy. This is one of the most overlooked causes of persistent pH lamp, and it hits especially hard for people in their 50s, 60s, and 70s, who are often taking more than one medication a day. First, ACE inhibitors. These are very commonly prescribed blood pressure medications. Enalapril, lisinopril, captopril, excellent medications for the heart, but they come with a well-known side effect. In up to 15% of people who take them, ACE inhibitors cause a dry, persistent cough which can come with excess mucus in the throat. Why? Because they increase a substance in the body called bradykinin, which irritates the lining of the airways. The most frustrating part is that this cough and pH LEM can show up months after you started taking the medication. You don't connect the pill to the symptom. You go to the doctor complaining about pH. LEM, they give you an antihistamine. It doesn't help because the problem was the blood pressure medication the whole time. Second, NSAIDs, ibuprofen, naproxen, diclofenac, widely used for joint pain, which becomes more common as we get older. These medications reduce the production of substances called prostaglandins, which, among other things, protect your stomach lining. Less protection means higher chance of acid reflux, and acid reflux, as you're about to learn, is the single biggest generator of throat pH. LEM that exists. Third, nasal decongestant sprays, oxymetazoline, phenylephrine, widely used over the counter. If used for more than 5 to 7 days, they cause what's called rebound rhinitis or rhinitis medicamentosa. Your nasal lining becomes dependent on the spray and starts producing more mucus when you try to stop it. A vicious, cruel cycle. If you take any of these medications and have persistent pH. LEM, do not stop your medication on your own, but bring this information to your doctor. Tell them you've been dealing with constant pH. LEM and ask for a medication review. Cause the silent reflux you don't know you have. Let me ask you something. Do you have heartburn? That burning in your chest? That sour taste in your mouth? If your answer is no, you're probably thinking acid reflux isn't your problem. That's exactly where the trick is. There is a type of reflux that causes zero heartburn, zero burning, zero classic digestive symptoms. It is called laryngopharyngeal reflux or silent reflux, and its symptoms are almost entirely in your throat. Research published in peer-reviewed literature lists the most common symptoms of silent reflux as excess mucus in the throat, persistent throat clearing, hoarseness, the feeling of something stuck in the throat, and a dry cough. Sound familiar? That is what you're feeling. Here's what happens inside your body when stomach acid travels up the esophagus and reaches your throat. It carries with it an enzyme called pepsin, which normally exists to digest proteins in your stomach, but your throat, unlike your esophagus, has zero protection against that acid, and when pepsin touches the lining of your throat, it literally irritates and inflames the cells there. What does your body do when it's under attack like that? The same thing it does when you get something in your eye. It floods the area with secretion to protect it. Your throat starts producing excess mucus as a defense mechanism. More mucus, more throat clearing, more irritation, more mucus. A cycle that does not stop on its own. And the scariest part is that you can have silent reflux for years without knowing it, because there's no heartburn, no burning, just that relentless pH. LEM treated a patient. Let's call her Martha, 68 years old, retired school teacher. She came in with persistent pH. LEM for 6 months straight. She had been treated for allergies, then sinusitis, 3 rounds of antibiotics with zero improvement. When he asked if she had reflux, she said, "No, doctor, I've never had heartburn a day in my life." So he asked her other things. Do you clear your throat more when you first wake up? Yes. Do you feel like there's a lump in your throat that won't go away no matter what? Yes. Is your voice a little hoarse or rough in the mornings? Yes. Do you eat something at night and then lie down on the couch or go to bed shortly after? Every single day. Silent reflux. We adjusted her diet, elevated the head of her bed, and in under a month, her pH. LEM had decreased by 80%. Do you have silent reflux? Answer these questions. Say yes or no to each one. If you say yes to 2 or more, silent reflux is a strong possibility. Do you clear your throat more than usual, especially in the morning? Do you feel like something is stuck in your throat that doesn't go away when you drink water? Does your voice sound different, hoarser, especially first thing in the morning? Do you eat dinner or a snack and then go lie on the couch or go to bed shortly after? Do you regularly consume coffee, chocolate, tomatoes, fatty foods, spicy food, or alcohol? Do you wake up with a bitter or sour taste in your mouth even without ever feeling heartburn? If two or more of those hit home, talk to your doctor about this possibility. The workup may include a laryngoscopy, a simple in-office exam where the doctor looks directly at your throat and vocal cords and can identify the inflammation caused by acid. What you can do starting today for silent reflux. The most important changes are behavioral change. Stop eating at least 10 hours before you go to bed. This sounds simple, but it completely changes the nighttime reflux pattern. When you lie down with a full stomach, the acid has now here to go but up. Change R. Elevate the head of your bed 4 to 6 inches, not with an extra pillow that just bends your neck. Use bed risers under the legs at the head of the bed, or buy a wedge pillow, the kind shaped like a ramp. The gentle incline uses gravity to keep acid down while you sleep. Change 3. Review your diet. The biggest reflux triggers are excess coffee, chocolate, tomatoes and tomato-based sauces, fatty foods and fried food, alcohol, mint, black pepper and spicy food, soda. I'm not telling you to give these up forever. I'm telling you to try 2 weeks without them and pay attention to what happens with your pH. LEM. For allergies and post-nasal drip, saline nasal rinsing is the most powerful and most underestimated tool you have. Pick up a bottle of saline nasal spray or neti pot, rinse at your local drugstore. Use it in each nostril twice a day, morning and night. This clears allergens, moisturizes the lining, and reduces inflammation. Studies from and associations strongly support this as the first-line approach for allergic rhinitis and chronic sinusitis. For chronic sinusitis, saline rinses help, but they may not be enough. Talk to your doctor about a prescription nasal corticosteroid spray. It reduces inflammation in the lining far more effectively. These sprays are safe for nasal use. They are not absorbed into your bloodstream in meaningful amounts, and they make a huge difference for most people. For medication-related pH LEM, the conversation with your doctor is non-negotiable. Do not change or stop your medication on your own, but bring this up at your next visit. Tell your doctor, I've been dealing with constant pH LEM and I'd like to find out if any. Start observing within 24 hours of consistent changes. You will notice a difference. Share this with someone you love who deals with this problem, a parent, a spouse, a friend who is always clearing their throat and has just accepted it as part of getting older. This information can change their daily life in a way they never imagined. Persistent pH LEM is not your destiny, it's a signal, and now you have the tools to understand it and act on it. Take care of your throat. It works for you every single day, without stopping, without complaining. Return the favor. Share.